So let's talk about acute lower back pain. Easily one of the most common injuries that we see here. Probably to you, it's pain, it's stiffness, it's a horrible thing that's stopping your life, your movements, your sport, your way you drive your car, the way that you go to work. That really is what acute lower back pain is to you. What we'll do on this video is we'll talk through what it actually is, so that you have a better understanding of it. Why is it a problem to you? Is it causing all of these things, these stiffness, these pains, this restriction on you need to do to get rid of all of these things, and physiotherapy is one option that you've got. So we'll talk through that on this video. First, an introduction to myself. My name is Paul Gough. I'm one of the UK's leading physios, currently a Northern Echo Health columnist, also write for the Hartlepool Mail. So I get to write about these back injuries, I get to treat them, I get to research them, I get to speak about them at conferences and at uni. So what I'm going to do on this video is try and give you as much help and as much advice and as much of an insight into what's causing your problem to stop it becoming a long-term problem, and also to obviously help reduce that pain as fast as we can. Behind any back pain problem, the real long-term secret, the cure, the relief that you are wanting and you're looking for is strength of your back muscles. Most back problems happen because muscles are just not strong enough at that point where you needed to lift something, you needed to twist, you needed to do that sport, you needed to sit for long periods. When your muscles are not strong, you end up with back problems. So get access to your exercises that you can start right now, free from me. Look on the webpage that you're on, put your name in, put your email address, hit send. You will get 3 of the best and most powerful exercises that I can give you to help your recovery from back pain, and you can start this recovery today. If you were coming in to see us, you made an appointment with one of our physios, these are the first level of exercises that we would likely give you to help your back pain. So you can get on with them now. So when you finish watching this video, just look on the webpage, look for the big headline, start your recovery now, put your name and email address in, and you can have these exercises from me to start today. So the real problem with acute lower back pain, this can easily become a long-term problem, and it's right now it's something that's just likely to be a tight muscle or a stiff joint. Back problems are like, think of a set of dominoes. You push the first one over and the whole lot will go eventually, doesn't matter how many you have. And a similar thing will happen with back problems. It can start off with a muscle problem or a joint problem, but it can quite easily, if these things are left, turn into a disc problem or a nerve problem. And these things, if you think you're in pain right now with acute lower back pain, if you are suffering with disc problems or sciatica, multiply it by 10. And that's what can happen if these things get left. So acute lower back pain right now, it can be very, very easily solved. How would you know if you had it? Pain is less than 6 weeks old. So this injury came on somewhere over the last 2, 3, 4, 5 weeks. If it goes over 6 weeks, these other things are likely to start happening. So we would diagnose acute lower back pain as something that's happened within the last few weeks. Pain came on instantly from an awkward twist or turn. So you leant forward in the garden, you tried to pick something up. As you did so, as you twisted, you got an instant sharp pain, probably felt like a spasm, muscles tightened in your back. And you know, most people do, even with this injury, come in and say, I feel like I've trapped a nerve. And that's not always happening. If you had true nerve problems, this nerve problems are in a different league altogether from this injury. It's more than likely that you have a muscle spasm, and every time you cough or sneeze, that muscle tightens. That's giving you the pain, the super sharp pain that you're getting every time that you move or you twist or that you cough or sneeze. So to sum it up, really, these muscles feel really stiff and really tight, and it's there for a reason, which I'll explain as I go along. And one more thing, even putting socks and shoes on, so just the ability to lean forward to do the dishwasher or get the washing out of the machine can be a problem. And most people really struggle on the morning when they first get out of bed because these muscles and joints are so stiff. So even putting socks and shoes on can be a problem. So your real definition of what acute lower back pain is, it's back pain that you've had for less than 6 weeks, and it's likely to cause an aching, stabbing or spasm-like pain. So something that you feel almost instantly. That, like I say, people sort of think that it's a nerve problem, but it's not. It's just a muscle that's really tight, causing you pain. And now the best way I can explain it to you and get you to understand it, or help you understand it, think of an elastic band. If you pulled an elastic band really tight, it would twang back into place. And that's kind of what's happened with the muscles. It's just been stretched so far, so fast, that when the pressure has been released or you've come out of the twist, this elastic band has twanged back. And it's the same with the muscles. Pulled really tight, and then it's gone into a spasm. If you move your back too fast too soon, you will get muscle spasms. And that's a real feature of acute lower back pain. So why do you get this pain and restriction? Why do you have this inability to lean forward, to pick the kids up, to drive the car, to put your socks and shoes on? It's quite simply because the muscles are so tight now, they're so stiff, they've tried to protect your back. You've possibly damaged ligaments. These are the tiny little things at the bottom of your back which connect the joints in your back together. They're not very big and they're not very powerful. They're just designed to attach bone to bone, but they can often be damaged when you've twisted sharply and your joints lock. Now, all of these things are happening as a protective measure. They cause you pain, they cause you inflammation, cause spasm, cause all the things that you're feeling, but in a strange way, they're designed to stop these things from becoming bigger problems. So the important thing, how can physio help? We will give you hands-on treatment, and you need this. You need hands-on treatment, you need massage, you need stretches, you need manipulation for the joint to free it off, to get it moving again pretty quickly. Even mobilization, which is a really simple way of loosening off this joint stiffness, this muscle spasm. We'll give you an explanation that's specific to you. Now, not a general one, not one of these fact sheets that you'll get off the internet or sent through the post. This explanation has to be specific to you, your life, your posture, your job, your sport, whatever it is that you do. We'll work out how to stop this thing from happening again. So we'll give you an exercise plan that you can do at home that looks to counteract this problem coming back, or being a long-term, lifelong problem that you would have to suffer. So you can visit us as soon as possible for help. It will definitely help you to get into this. Do not let this go past the 6-week mark. Once it does, we start looking at problems with nerves and discs and things like that, and that takes a hell of a lot longer than the 3 to 4 weeks and even the 3 or 4 sessions that you will currently need for this injury. So to confirm, we would do deep massage, stretching, exercises, hands-on. Our clinic here is very, very hands-on, so whichever you choose, Darlington, Durham, Guisborough, Hartlepool, you can be assured that any of our physios will be really hands-on, and we all do very similar techniques, if not exactly the same techniques, to get you out of your pain from acute lower back pain. So we're in Darlington, Durham, Guisborough and Hartlepool, and one thing we always offer any of our patients as they visit this clinic, we will always give you your session free if physio can't help. And what that means is, if we can't give you the hands-on treatment, we can't give you a great diagnosis, and we can't give you exercises, we can't do any of those 3 things, we will give you your session for free. And to get your session booked in for physiotherapy, to get the relief and the treatment and the advice that you need, you just need to call 0800 043 8671, and you can even use that number to call and speak to one of our physios if it'll help. You want more advice, you want to ask more questions, or you just want more exercises, that's fine, just give us a call. But if you want to book your session, you can also use that number. And just before I go, I'll just give you a quick sneak preview of what it's actually like before you do get here. That's live inside our Guisborough clinic there on Challoner Street, and this, believe it or not, is our staff doing an in-house yoga class. Every person that you speak to or meet here, from the admin team to the accounts team to the physio department, they're all really active, they're really friendly, they're very outgoing, very outdoorsy sort of people, and we love doing this lifestyle sort of stuff. So we do Pilates, we do in-house yoga, and occasionally we invite patients along as well. So and that there is inside our Hartlepool clinic. So your number you need, 0800 043 8671 gets you through to us. You can book your session. Hope this has helped. That's it from me. Thanks for watching, and I'll speak to you soon. Take care.